What started out as a very ordinary day with a routine appointment ended in the most bizarre and tragic way imaginable. A man in New York tragically died after being literally sucked in by an MRI machine.
Our next story takes us out to New York. Really a bizarre story that turned out very, very unfortunate for a man in a major MRI accident. And so for more on this, let's go out to Fox News' Nate Foy with this latest of this really unusual story, Nate.
Hey, Mike. So the widow here, Adrienne Jones McAllister, says that she asked for her husband, Keith, to help her get up from the MRI machine after she got a scan on her knee. But when he entered the room, the magnet in the machine latched onto a heavy metal chain that was wrapped around his neck. So that chain weighed roughly 20 pounds. It had a padlock on it that he used for weightlifting. Adrienne says that she and the technician tried pulling Keith away from the machine, but ultimately they couldn't save him.
Welcome to Clinical Charts with Dr. Williams, where we shed light on common health problems and medical conundrums. Give a video a thumbs up and subscribe for factual medical information. It was very important to make this video as a reminder of safety measures, as well as to reassure you if you or your loved one has got an upcoming scan. You've probably heard of an MRI before, perhaps you've had one or a relative or a friend has. So, what exactly is an MRI, and when do you have to get one? MRI is an acronym for magnetic resonance imaging. It's pretty much a safe way to get pictures of your internal organs without the harmful radiation of X-rays and CT scans. How does it work? MRI uses strong magnets and radio waves to create detailed images of the inside of your body. The human body is comprised of mostly water, with an average of up to 60%. This percentage varies with certain factors like age and, of course, with different tissues. Water contains hydrogen atoms. The pull of the magnet in the MRI causes those hydrogen atoms to align in a specific direction and then subjects them to short bursts of radio waves, which then knock them out of alignment. Withdrawing the wave energy causes the atoms to fall back in line, creating a signal which the scanner translates into detailed images. So it's pretty remarkable advanced technology which is invaluable to the diagnosis of a range of conditions: brain injuries, strokes and tumors, spinal cord problems, heart and liver problems, uterine joint pathology, and even early signs of multiple sclerosis. What to expect during an MRI? Ideally, before your scan is scheduled, you should have had a safety questionnaire administered by your doctor or, in some instances, your technician. There are quite a number of questions that you'd want to think carefully about, and apart from the example in the subject of this video, there are a few other things you need to be aware of. Remember, getting an MRI is completely painless. Okay, the MRI itself is painless, but if you're getting a contrast or dye injection to make the images clearer, you may require a cannula or medical needle in your arm. You will be told to remove any metal bits on you, such as jewelry, hair clips, and if you're a woman, even your bra should be removed as it may contain metal bits. You should not take your mobile phone into the scanner room with you. MRI scanners can be quite noisy, and the noise can be slightly annoying or at worst distressing, the latter more so if you have auditory problems or use hearing aids. You'd very often be given earplugs, earmuffs, or headphones with music. Depending on how extensive the area is to be scanned, it could take anywhere from 30 minutes to a good hour and a half. You will be required to lie on a table that slides into a large tunnel-like machine called the gantry. Some people are terribly claustrophobic and may struggle with being cooped up in a narrow tunnel. If you are claustrophobic, speak to your doctor about options. There may be alternative scans to aid the diagnosis just as accurately, or you may be given an anxiolytic or may be able to get an open MRI where available. It's extremely important to keep still. While you will be the only one in the scanning room, not to worry. There is a built-in microphone for two-way communication so that you can speak with the technician or doctor on the other side of the glass. Are MRIs safe? Yes, indeed, MRIs are generally very safe. Because they don't involve radiation, they are the go-to for people who require multiple scans or are more vulnerable, like children or pregnant women, with some exceptions. Also, for certain conditions and tissues, they are the gold standard for diagnostic imaging. The only real caution is for people with metal implants, pacemakers, or bits of metal shrapnel in their bodies, because the powerful magnets could interfere with those devices or bits of metal. So you always have to declare if you've had any recent surgeries to enable doctors to assess the device MR compatibility and to determine if sufficient time has passed. You may need to wait 6 to 8 weeks to ensure that all inflammation after your surgery has settled, surgical sites are healed, and to reduce the risk of tissue migration, damage, or heating of surgical hardware. Any implants, clips, prosthetics, or devices as compatibility needs to be confirmed. Now, if you've had a surgery, it's important to tell your doctor the date and location of the surgery, as your doctor may be able to request surgical reports or consult the device manufacturer to confirm MRI compatibility. Fortunately, most newer devices for operations, such as joint, heart valves and stents, and dental implants, are non-magnetic. If you've got any doubts or had surgery so long ago that you're unable to determine the character of your implant, it is best to avoid MRIs. Remember, every situation is unique, so it is important to speak to your doctor and don't be afraid to ask questions or voice your concerns. There is no such thing as an impertinent question. So what went wrong with this MRI disaster? The man who passed away was wearing a very heavy chain, and not only was it a highly magnetic metal, there was a lot of it by weight. The report says about 20 pounds of it. As he walked into an active magnetic force field, he virtually stood no chance. It's reasonable to assume there may have been a few fade-ins along the way. Several questions come to mind. Why was he allowed access into the scanning room? Why was he not stopped from entering the room? Why did his wife require his assistance? Was the technician adequately trained to effect an emergency shutdown, which is called a quench? However, while investigations are going on, it's important to keep in mind that a life has been sadly lost. A reminder of safety measures to prevent recurrence is necessary. Never ignore warning or danger signs or symbols when in a healthcare facility or anywhere for that matter. If someone's taken the trouble to hang it up, there's value in adhering to safety instructions, no matter how innocuous an action or place may seem. Except in clearly permitted cases, such as may be necessary with very young children, only patients should be allowed in scan rooms. It really should never be the duty of a non-staff member to assist patients in MRI or CT scanning rooms, and staff should be well trained and vigilant at all times to escalate emergencies that can arise with a patient being scanned and to prevent unauthorized persons from entering the MRI room. Patients should be adequately supported with dignity to get off the table and get redressed, staff are trained to adjust the height of a table. Be mindful, even when no scanning is in progress, MRI machines are still running. Often a resting hum can be heard. They are never usually shut down. The reason is because near zero temperatures are required for most MRIs to function. Most MRIs contain superconducting magnets. Liquid helium is used for this cooling process. The process required to turn off an MRI is called a quench, when the MRI's magnetic field is rapidly shut down by allowing the liquid helium to warm and boil off. It's a pretty serious and expensive process which uses up a lot of helium. Helium, by the way, is terribly expensive, and it can require days to weeks to effect a reset, as well as could potentially damage the MRI scanner. Only during maintenance or installation are MRIs usually switched off, or if the magnet type is what we call a resistive or permanent magnet. Without question, an emergency like someone being sucked into a machine requires a quench. It was not mentioned in the report, but I will follow the story very carefully. So, final thoughts. If your doctor recommends an MRI, don't panic. It's safe, it's smart, it's powerful, and it just might give you the answers your body has been trying to tell you. Please be kind and respectful in your comments. A life was lost. May he rest in peace. And be sure to like this video, subscribe to the channel, and share it. You just might save a life or a job by doing so. See you next time.